Anisha, all okay at your end? I think you're not audible or there must be some problem here.
Can you hear me?
Yes, now you're audible, yes. Hmm. They're audible now. We'll start. Because there are other people to join, they'll join in between. Meanwhile, you can start. And I think those who are joining the session for the first time, initially, please keep yourself on mute, but you drop in your question here in the chat box. Once Anisha will finish sharing her screen and the points she has to make, then she can take the questions one by one.
Ma'am, just 1 second. So I'll be sharing through my I'll be sharing my screen, and just give me 1 second for that. Yeah, so am I audible?
Yes, you are.
So ma'am, can you please make this one as primary? Yeah.
Yeah.
Okay. So shall I start, ma'am?
Yes, please go ahead. Those who will join, they'll join in between. I think there are a lot, I think, but they didn't join. I have to send them recording that we'll do later, but we'll do it now.
Okay. So for people who are here, hi, good evening, everyone. This is Dr. Anisha Galotra. I had secured a rank of 352 in last year's NEET PG, and I had also secured a rank of 109 in November 2023 INI. So guys, this session is going to be mostly focused on how to approach November INICT, which is going to be happening in next 3 months. And most of you, I think, are just here after your NEET PG is over, and you guys have still not received your results, which will be out really soon. But I think it's time for you guys to move on now, and I hope most of you will be expecting a good result only. In case you're not, then so we definitely have to sit for NICT. In case you are, still I feel then you have a better chance of sitting for this NICT and getting a central institute, right? So either way, we have to give it our best shot for the next 3 months. See, guys, a bit of a history from my side is that I also prepared for November NICT for 4 months and I got a rank of 109. And I'm not kidding in that. I was a decent student while I was preparing for MBBS. But that being said, there were people who were practicing for 1 year. And I mean, I did it in 4 months because I kind of knew how to smart study. And I will be trying to inculcate that in you for the next 1 hour. So let's just get started. So basically, what I'll be doing in this 1 hour is that I will be discussing the basic strategy, the things that need to be that you need to do. Just 1 second. Yeah. Okay. The basic things that you need to do. Most of you guys already know what you need to do, but at the same time, ma'am, you will be admitting these, right? Yeah. So most of you guys already know what to do, but I will be adding on those extra few points which I feel are very, very necessary for INICT, especially when you have to complete the entire syllabus in 3 months, right? I will be quickly taking you through the basic strategy in the next 25 to 30 minutes, and then I'll be taking up your personal questions, if at all. And I feel there will be not many people because I feel most of the people are still anticipating for their NEET PG results. So then it will be a very focused discussion that way. Right? So let's just get ahead. So, guys, the basic strategy includes four things, as everybody knows theory, MCQs, GTs, and PYQs. See, guys, theory, I think most of you are sorted with your resources now. Whatever you have done for your NEET PG, I feel you should stick to it. In case after you came back from the exam hall, you feel that there were certain subjects you were not very confident about, then you can definitely switch that. But I would really, really recommend you against switching the resources because you've already done it. What happens in the exam hall is that you get confused because whatever base you've made from the basic theory that you've done, that will come to you in the exam hall. And in case you've switched that theory, then it will confuse you. So I feel whatever you've chosen, if you're not a new fresh start, which I feel not many of you will be the freshers, most of you will be the previous students only. So just stick to your whatever resources you had decided for yourself and revise it. Right, I will tell you how to revise it in the next 3 months. Then MCQs. Now, what to focus more on MCQs is one, INICET is a different body than NEET, so INICET PYQs takes precedence over NEET PYQs. Very rarely NEET PYQs get repeated. I would suggest like give it don't even solve one paper in case you feel that you are very underconfident, you are in that FOMO that everybody has done it. I am sincerely suggesting you to just go for last year's NEET PG and this year's NEET PG, and that is it. That is it. Not even more than that, guys. I really don't feel that you will be wasting your time. You can go above and beyond for NICT PYQs till 2017, even till 2015. That will help you much, much more than even solving NEET of 2023. Right, so this is where you have to put your focus into for especially for MCQs, PYQs, right? This is what I was discussing about PYQs. Now most of you have so many doubts as to what needs to be done beyond the PYQs. See, guys, if you're just doing PYQs, which everybody is doing, then you are in the race. Definitely, you're in the race. You have to make sure that you don't get anything wrong from these PYQs because that is the bare minimum. Most of your peers will be getting these PYQs questions right, so you cannot afford to get it wrong. But now, how to create that edge in the exam hall is that you do certain extra questions. How to solve those extra questions very, very wisely and smartly so that you cover most of the topics, and at the same time it does not get overwhelming for you, but because at the end of the day you just have 3 months in your hand. Now, how to segregate it? There are n number of platforms. I don't want to name any, but there will be custom modules in each of these platforms, right? I don't really suggest you watching doing the detailed Q bank. You have to do custom modules right now because what will happen is that it will fetch you questions from multiple topics, multiple subjects, so that you have a fair idea that I've touched upon the basic topics and there is no topic that is left out. If you solve a particular Q bank module, let's say ulcerative colitis or GI ka any module, one, there will be a lot of conditioning in your mind because your mind will get trained that I need to know the topic before even solving the question. We don't want that. Secondly, what will happen? You will master certain topics which may or may not even come, and there will be topics which will be entirely left. That is also something we don't want. So, how to set these custom modules? If I were in your shoes, what I would have done it, what I would have done, I would have segregated each subject in 5 7 days, whatever you've decided for yourself. And then in the night, just make a 50 Q bank, a 50 questions ka custom module for the topic that you're doing. Let's say you've done urology or breast or endocrinology. Let's say you've three things you've done in one day, which I feel this is the need of the hour right now. Those 3 months is a little too less, and we have to complete the syllabus 2 to 3 times bare minimum before we sit for NICT. So you have to be covering three topics right now in one day. So you've done urology, breast, endocrinology on day one. In the night, just put a custom module of all tags of urology, endocrinology, and breast. There will be questions coming up differently from everything which urology, breast, and endocrinology has to offer. So you will get a fair idea ki, okay, let's say hypospadias surgeries got missed out. You will be aware ki, okay, this was something that was missed out. You will revisit your notes or whatever, some you can add also, and you will have a fair idea ki, this is something which I have to add into my RR notes, BTA, whatever you're doing, right? So this is how triaging looks like. 50 question for whatever topic you're doing, and revise it very, very thoroughly. In case you're solving marrow or preplat or whatever, I know every platform has an extensive explanation to all these questions. I feel the magic lies in the review of these questions. So solve solve these questions, 50 questions in a specific time frame, let's say 40 minutes, 45 minutes. That way you're also solving one block every day. It should be NICT pattern only, that is 50 questions in 45 minutes, right? That's one block of NICT. Then for the next 1 hour and 15 minutes, you are extensively going through the review, the explanation, and making sure that there is no topic that is left out, right? This is the best thing that you can do right now. Now, coming on to day two, you will repeat the cycle for the next 5-7 days, and you will complete surgery. In the day, you are doing that particular specific topic from your RA notes, which you have already done, so you're very confident about it. In the night, you're solving this bare minimum one block of 50 questions every day. If you are very confident with your theory, if you have already done it many times before NEET PG, then what your approach should be that you have to solve maximum number of questions right now. You can solve 2 blocks every day. Like bare minimum is 50, and I feel the maximum limit that you can go is 100. But just make sure that you're extensively reviewing it. For the people who are very confident with your theory and they don't know how to proceed, I'm telling you, things will change, magic will happen if you extensively review your questions. If you segregated that, what am I doing wrong? What am I doing wrong every time that I'm not getting the question right? People tell it to me that this was a silly mistake, that I just got confused in 2 options. No, you were not clear about those 2 options. Everybody could rule out those 2 options. Now you were down to do, you think that you were down to those 2 options, but everyone is down to those two options. The examiner knows that 99% of the people will be able to filter out these 2 options. So you have to be very clever and wise that, okay, this is something I'm not sure, I am not confident. I will go back to my notes and read it and highlight it for my second cycle because I am again and again faltering in this particular topic. This is where MCQs help you, right? So 50 minimum, 100 maximum, that is the best thing I think you can do every day. If you do that, you will be also initiating a habit of solving 2 blocks every day, which will help you massively in the exam hall. I'm telling you very honestly, guys, if you make it a routine in the exam, your brain will be like, okay, it's like a normal day, this is nothing new for me, and it will not go into that panic mode, right? Then coming on to the next thing, that is GTs. How often do you need to give your GTs? See, um, if you are not a fresher, if you have already done it, I feel GT should be bare minimum now once every month. Once, not even once every month, once every 15 days, every fortnightly, you should be giving GTs because now questions are going to help you. GTs will simulate how the exam is actually going to happen, right? I feel now people are very well thorough with your theory, with their MCQs, with their PYQs. Where they're faltering is that they are not, they are not very good exam givers. You have to train yourself to become good exam givers, and this is where GT helps you, right? You sit in a exam like situation, simulate the entire exam hall scenario. You've already gone through NEET, so you already know what happened in the exam hall, right? Maybe you got panicky, maybe there were things which were not going in your favor, maybe there were negative thoughts. So when you're sitting for a GT, make sure that all these things, let them come to you, let the negative thoughts come to you, but train your mind on how to divulge them, how to distract yourself from that, and how to focus in your exam, right? So if you practice sorry guys, just 1 second. If you practice again and again on how if you practice again and again by GTs, through GTs, you will be very much more acquainted with the exam hall scenario, and your brain will be trained that, okay, this is how the exam looks like. So give GTs every 15 days, I would say, and review them on that very day. Now you're very well versed on how to review the GT. So 9 to 12 ka slot, which is the exam ka slot, you sit for the GT without any interruption, without any breaks, without any food. Nothing should distract you for those 3 hours, and then take a 1 hour break, 2 hour break, whatever you feel like, but complete the review on that very day. Guys, you will forget the next day what you had in your mind while you were solving that question. You need to know that this was the trail of thought that I had, and this is where I'm faltering again and again. So please do not perpetuate or postpone your GT review. Just solve it on that very day. Try to complete it. If you cannot, maximum you can stretch it to the next day, but please do not postpone it to the next day. You will forget what your trail of thought was, right? Now coming to the next thing. Okay, so people ask me on how to complete your syllabus in the 3 months. I have segregated a plan for you, which I would have done, right? So if you're starting right now, just right now, let's say you start on 15th of August, then first cycle should be a a fairly relatively more extensive cycle, which should be 1 month and 15 days long. What you need to do in this period of time is theory. Maximize theory in this very cycle, because after this cycle you will be heavily focusing on your questions, your pyqs, your exam giving strategy. Then theory is not something that should be done, because you have to train your mind into solving more questions, right? So make sure that whatever theory, the maximum content that you want to cover as of now, you cover in the first cycle, right? So what needs to be done is that you complete all the 19 subjects from all those resources which you had decided for yourself for NEET only, right? Just go through all those resources and that is it. But just cut short the timeline. Make a blueprint. This is what I tell everyone. Make a blueprint of how you're going to be completing your syllabus, 19 subjects in 1 month and 15 days. You have to wrap it up by 30th. Don't go blindly. Just how long it will take. Don't do that. Be disciplined for the next 3 months, and magic does happen. Things do change if you become disciplined for the next 3 months, right? So just plan, just make a blueprint on how you're going to be completing your syllabus in those next 1 month and 15 days. A broader timeline only, that surgery I will be covering in the next 5 days, medicine 5 days, broader timeline. But before starting that subject, let's say you've decided that 15th to 20th I will be completing my surgery. How to go about surgery is first, that in before starting of that subject, one night before that, you just make a schedule that okay, on this day I will be covering urology, on this breast, endocrinology, so on and so forth. And in the night I will be solving 50 questions or 100 questions, whatever you feel like, right? And if I were in your shoes, what I would have done, that on the last day of completion of that particular subject, I would have solved my SWT. I used to take this as a test, that I have to prepare for SWT because it fetches you a rank, so that you become conscious that there is an exam which is coming up. I have to prepare for that, right? So solve an SWT towards the end. This will also give you that motivation, that incentive that I have to prepare. Plus, you will get a rank. You will understand where your lacunas is, and you need to work on certain subjects or not, right? Now you're solving your theory, you are solving 50 questions every day bare minimum, right? And you complete your syllabus on 30th. You are very, you're in the race, you're good to go. Now the second cycle should be from 1st of October till 25th of December, October, 25th of October. Why I'm saying this is because you have to reserve your last 10 to 15 days for your last revision before your exam hall. I think the NICT date has been announced, which I think is 9th November. It usually is in the first week of first Sunday of November. So that is 9th November, because 1st November is a little too early. So I think that will be on 9th November if it is yet not announced. So just make sure that from 1st of October till 25th of October, you complete your second cycle. Now, guys, what to do in your second cycle? Number one, definitely you're touching upon the theory which you have highlighted in the first cycle, but this should be very less. Why I'm saying this is, guys, because you've done it for NEET, you've done it once more after your NEET, you should be confident by then. If you're not, just have that faith that now it is in your mind. You just need to brush up those certain points. Just highlight in the first cycle itself that these are the small peculiar points which I need to brush up in my second cycle, and I will maximize my Q bank now. From 1st of October till 25th of October, try to maximize the number of questions that you're solving. What happens is that most of you know what the theory is, most of you know what the content is, you've covered everything, and you're not able to make any progress. Why is this? Because you don't know how to apply it. What happens in certain diseases, but you just don't know how to solve that particular question when it comes as a clinical scenario. So that is where questions will help you. It happens especially in the clinical subjects, in surgery, in OBGYN, where you know what the flow chart is of abruptio, placenta previa. But when a question comes in front of you that this many weaker placenta previa with these vitals, fetal vitals at this, and then the first step of management was done, then what is the next step of management? When it comes to you in that picture, in a maths question kind of a way, then you get puzzled, then you get perplexed. So you need to train your mind that this is like a fear, like I'm good to go, I will solve a certain question, and after 50 questions or so you will get the hang of it. You will be better acquainted to solve such questions. So please maximize your Q bank. In the second cycle you should be doing around 75 questions every day. I mean, I don't want to overwhelm you, but guys, the maximum number of questions you do in the second cycle will help you the most, right? And the frequency of GT should be like, in these 25 days, you should be giving three or more GTs, three to four, what you can give, because after this, you should not be solving any GTs. Maximize the number of GTs that you are going to give in your second cycle. Last 10 days, I would not recommend you doing any GTs. Now, last 10 to 15 days, I think I have extensively talked about what needs to be done in the last 10 to 15 days, but just to brush up, see, by the end of 25th of October, you should be prepared on what you need to do for all the 19 subjects. There has to be theory. If you are an avid BTR subscriber, you can solve BTR, you can go through BTR for all the 19 subjects. It will not take you much of time. But if you are a person who has done rapid revision of certain platforms, then what you need to be doing is that, by the end of second cycle, there should be content which you've already highlighted. There should be content which that, okay, from anesthesia, I will do these chotu tables, and that is it. You should know, you should be very well prepared that this is the limited amount of content which is volatile. Second is super, super important. And third, I will forget. This is a personal, shortcoming of mine, that this topic I again and again forget. You should know your personal setbacks as well. Even if it is something that is easy for somebody else, but if you're again and again faltering, if you're again and again forgetting it, then you should remember that you include it in your choti copy, and you have to do it in the last 10 to 15 days. So, volatile, important, personal shortcomings. These are the three things which you include in your choti copy for all the 19 subjects. Also, guys, just beware, in the last 10 to 15 days, there should be no subject that you leave untouched. There should be no subject. There are people who say that anesthesia is not important, physio is not important. I'm just giving examples. It's not the case, guys. You have to do certain few things, certain few niches, because it is not only about the content, it is also about the confidence you have for that particular subject. If you go in the exam hall thinking that I've not done physiology at all in the last 20 to 15 days, a basic physio question, you will even stumble upon that. You will even falter in that, because you will not have that confidence. Your brain will be inhibited that I have not read it, I don't know the question. So, guys, please, this is what they say is, fake it till you make it, right? So you have to fake in your mind ki I've done physio. Even if you have done it for like 2 hours, 3 hours, but you have to confuse your mind that I've done it, and I am very well acquainted in solving all the questions of physiology, right? Because if you don't give yourself that confidence, that boost, then you will not be able to solve even the easy questions. And secondly, guys, INICT has a knack of asking very vague, very bizarre questions. So there will be certain questions which will be anyway out of your reach. So you can't be leaving the easy questions, the moderately difficult questions, because there will be a lot of questions which will be extremely difficult. You have to be prepared for the moderately tough questions as well, because you have to give a shot in at least those questions, right? Now, so guys, approach specific to NICT. This is the most important slide, in my opinion, because most of you have already solved NEET, sat for NEET, so you know how NEET looks like. But there are people who were who had their first NEET, right? So INICT is a different ball game for you. I am going to tell you how it is different from NEET. First, guys, there is a preconceived notion that second year subject weightage is more. That is true. When I was also preparing, there were a set of people, seniors, who had aced the exam, who used to tell me that it is very much heavier on the second year subjects. But guys, I have seen the trend changing, and I've actually researched about it. If you see in the last 2 3 years, the trend has changed. Now there is no pattern. The lines have gotten blurred. In NEET, last year's NEET was very much heavy on second year subjects, but the second set was heavy on fourth year subjects. So you can't make that assumption. You can't take that guess. I would say that definitely build your subject strong, build your base strong. That is the first foundation strong. That is the first and second year subject, but you cannot compromise on your final year subjects. There is a very high probability that the situation gets flipped. You might get a lot of questions from surgical subjects. That is through final year. You have to master surgical subjects as well. So don't prepare with this assumption that I have to just focus on micro pharma. No, you definitely have to focus on that, but please don't even think that surgery or OBGYN will not be asked that much. It can be the situation. It most likely will be the situation that the weightage will be mostly equal only, right? So don't be under that impression. Just treat it like any exam, just how you treat it for NEET, but there is one thing which I would like to tell you is that you focus on your INICT PYQs. Now from these PYQs, you somehow squeeze out topics. You just try to figure out that this is the pattern that they are asking. I remember when I used to prepare, I had figured out that cystic fibrosis is their favorite topic. INICT loves cystic fibrosis. So what kind of a pattern INICT has is that they research from their PYQs. The professors take these questions from the PYQs and go into deeper depths of such questions. They go in that depth of that particular question which was asked previously. So just figure out that these are certain PYTs. Now you go into depths of these topic. Even if there is something very very bizarre about cystic fibrosis, you remember it, because this is what AIMS ke professor do, right? They somehow take out these papers, find these topics, we find these PYTs, and they go into different depths. Maybe they will ask you a different new drug about cystic fibrosis, a new mutation about cystic fibrosis. These are the difficult questions only, but you can take an educated guess because you already know that cystic fibrosis was an AIMS INICT favorite, right? So just focus on the PYQs, take out certain topics that these are the two things that they are again and again asking. I will go into deeper depth. You revise cystic fibrosis from the main notes. This is what I used to do. Secondly, whatever was asked in last year's INICT, in May INICT, you also focus on the other options. This is what they do. All the other options are potential new questions for INICT. AIMS professor, this is the trend that they have. I have seen that they somehow make new questions from these options only, from these previous year questions only. So you be very wise and you write down these topics. Okay, this was asked as other option. I will somehow research about it. There is a probability that in the next exam you will get a question about from those topics only, right? Now, BTR and first aid. See, it is definitely true that BTR and first aid does build a foundation for you for first and second year, which is mostly important for INICT. There are so many videos about famous people who have aced INICT. So they tell that they definitely recommend you doing first aid. But I also was of that opinion that first aid needs to be done. But now I feel that BTR does the job for you guys. First aid is a golden book. But if you're starting right now and you have to sit for INICT seriously, which you should, then first aid is something where you will waste your time because it is an extensive book. It will consume a lot of your time. So the easier hack is just go with BTR because ma'am has covered most of the things which are relevant for INICT from first aid, right? You can take that leap of faith on ma'am, and you can just, I have done first aid very very thoroughly, guys. There will be minor one two things which ma'am has not covered, and there is a very less probability that these will get asked in INICT. So you can leave out first aid as of now, but if you genuinely want to do it for the next NEET or INICT, whatever. First aid is not something which you will be able to complete, let alone revise for upcoming INICT in November. So do BTR. That will build a better base for first and second year, better foundation. First aid, you can definitely plan on it after you're done with your INICT, right? Now, PYQs takes precedence because this is the trend that I have already emphasized on it. Just make sure that you go to you go that extra mile for PYQs. If there any app, Cerebellum, or there was this thing which Dr. Aditya had started, whatever you can find, just make sure that you do as many PYQs as possible. If you can do till 2014, 13, whatever you feel like, this will help, because I remember that people had done it and questions do come. You will come across a question from 2014, 13 that does happen, and it will fetch you that extra edge in the exam hall. But just make sure you go into these things only when you're done, at least till 2020, right? Please don't be under that impression that I will start from 2013. That is not how the trend is. The exam pattern has massively changed. So guys, first of all, go retrospectively, start from 2025, the recent most, and then you proceed till 2014, 15, 13, whatever you feel like. But this will actually help. INICT loves asking PYQs. You know that before that long ago as well, right? So just do it till 2013, 14, wherever you can find it from, and that will help you. But it is not must. Please do not overwhelm yourself that somebody has said to do it till 2013 or 12. It is not a must. Must is till 2020. After that, it is definitely your choice, plus the time you have in your hands, right? And then, of course, the last thing is GT specific to INICT. I feel there is no point in skipping one year of GT. because the questions are really difficult for NICT. NEET tests every day on similar level. There are easy questions. This year, NEET was also easy on the easier side only, as how it is expected. But INICT is usually on the tougher side, right? So solve GTs because you have to train your mind that there will be a difficult exam that will be coming up. An easy exam, please don't expect an easy exam. That is not how INICT works. There might be some one or two exams which were easy, but most of these exams are difficult only, right? So solve INICT specific in the GT point. Yeah, I'll just cater to your questions. Just solve the INICT specific GTs, plus there is a different timer, right? Please do not train your mind into solving a GT in 3.5 hours, because you have to solve it in 3 hours in INICT. That will not happen automatically. You have to train your mind into sitting for those many hours, plus completing your exam. What happens is that you are in such a habit of solving NEET PYQ, NEET GTs, that you forget that you have to complete your exam in 3 hours for NEET, INICT, right? So GT should be very specific to INICT. I have already taken a class on how to solve questions specifically for INICT. How to, there is, I've also posted on my YouTube and Instagram, whatever. So you can like follow, and people, you can go through those videos or whatever you feel like. But and also we can take another class if you want on how to solve specific INICT questions. But just remember that INICT is on the tougher side. It is a difficult exam for everybody. So there will be questions which will be really easy, which are around 100. First, you reach to this level, that I have to get to this level by doing my basic theory, which I have done for NEET. These will be really, really easy questions, very on point questions, but they will test your presence of mind. So you have to train, okay, these are some easy questions. You find these questions that this is an easy question. I will not waste my time. I will not confuse myself. I will solve it. I will mark Down syndrome because trisomy 21 is given. Chapter closed. 100 questions, you reach there. 50 questions will be after you exclude certain options. These will be the questions where two options which you will be able to figure out. Next two options, now you have to prepare in these next 3 months for these 50 questions. I have to make sure that I know the distinction between these two options, right? Because this is where you will make the biggest leap for your exam hall. 50 questions. You reach till 150. After this is actually, a game of one luck. Because guys, I feel that there are certain topics which you just stumble upon before your exam, and you somehow go through it, and these come up in your exam, right? One is luck. Second is how much you have given in the next 3 months. There are people who study for 16, 17 hours. I don't think it's healthy, but if you can push yourself, you should go as much as you can. I will not tell you that study for 17 hours, because I have also myself not never done it. Study smart, study wisely, but at the same time just make sure that you have that certain specific edge over other people. You are not doing just the basic shit which everyone is doing, because then you will be in that crowd only, in that clustering only. You have to somehow make that extra mile. You have to go that extra mile, that extra distinction you have to make for yourself. So when you're studying 10 hours a day, where you've covered most of your theory, you've solved these questions, 50 questions, 100 questions, just make sure that there is something that is extra that you're doing, maybe compiled modules of BTR, or maybe pearls of marrow. You're just making sure that you are somehow covering everything, which you could not cover in last need, right? You have to have that edge. So I would say go that extra mile in the next 3 months. So put in 12 hours, 13 hours, the north of 12, 13 hours if you can. But please have a healthy schedule. Please do not, you have to have a sustainable schedule, because you have to sustain it for the next 3 months. Don't have an unhealthy schedule. At the same time, just find that sweet spot, right? Please find that sweet spot. So last thing from my side is this: it always seems impossible until it's done. I have, I used to follow this very thoroughly. Why? Because 3 months is a little too less. If you are someone who's getting very less correct according to the recall for NEET, you might be in that under that impression that I cannot do it in the next 3 months. It's not the case, guys. I'm telling you, I'm not giving you that a fantasy. I'm not just, um, putting it out like a hoax. It's not that. I remember that I had 4 months, but I had that belief ki nahi, I will give it my best shot. So guys, just give it your best shot. It looks impossible until it is done. You might be that person after after you are done with your INICT, November INICT, you might be that person who tells this story to hundreds of people that I had just started with my preparation, but I studied it wisely and I had that belief and I aced the exam, because this really does happen. So please do not give up. Try to have one Discipline, definitely. Second, a plan. First make a plan, of course, sorry. First make a plan, then the discipline to follow that plan, right? Please do not procrastinate. Please do not procrastinate for these next 3 months. It will be the biggest enemy for you. Do not procrastinate. Make a schedule down to every hour and have the discipline to follow it for the next 3 months, right? Then study wisely. As I've told you, focus on INICT related specific GT, specific PYQs. Go into depths of the topics which were asked in previous INICTs, right? Go into depths of the other options, the wrong options in the last INICTs, right? Don't try to do NEET, don't try to follow anything, which anybody tells you. Have a very focused approach, devise a plan specifically for yourself, listen to seniors, listen to people who have aced it, only if you trust. If your gut, if your mind feels that this is a person who is talking rubbish, please do not follow them. If I am that person for you, please do not follow me. At this point of time, whatever your mind says is right for you, just take that step. Your instinct is the right instinct at this point of time, right? So that is it from my side. If you have certain specific doubts, I will cater to them in the next few 10-15 minutes, right? And this is like a small group only, so just feel free to ask anything, any bizarre random thing you want to ask from me, right? Okay.
Yes, Mahर्shi, please unmute and ask.
Yeah. Hi. Hello. Good evening. So I wanted to ask that matlab I did BTR for NEET PG and I'm getting a good score in the recalls. So like everyone is saying, as you said, that INI is a bit deeper and BTR is a bit lateral, as you know, matlab you are the ranker. So should I like do RR of the important subjects or not? That's my question. And I like tried to give an INI set GT in the last week, but every time when I give the INS at GTs, my score gets around at 135, 140 only. And that's like nowhere good, as you know. Like, you cannot get anything at that rank. So, like, I don't know how to get that extra mile in the topic. Should I do the depth of RR? Because BTR I have done and BTR, as you know, it covers the lateral aspect of all the topics. So it helps in NEET, but I don't know about INI. Actually, this will be my first INI, the serious attempt. So I actually don't know like how to go about the depth.
Okay. So see, if you have just followed BTR, that is definitely a lateral. But I feel if you have subscribed for BTR, just do everything that BTR has to offer. People say that BTR is not sufficient, but I feel these are the people who have not done everything. They just say this after doing the videos that ma'am has to offer. Don't do that. Just follow one resource. You can absolutely just follow BTR as of now. One, why? Because you don't have the time to start something new and revise it. You definitely don't have that time. If you have already done certain RR, then you can focus, you can just skim through that, but don't start something new because you will not be able to revise it. Second, do everything which BTR has to offer and it will complete the entire thing for you, right? Compiled modules, choti copy, mega need BTR, extra things which ma'am is doing, special, Robin special, guidance special, do
Yeah.
everything which ma'am has to offer. Follow ma'am religiously and solve these ENDs. The magic lies in the END ka review. Ma'am tells so many points, so many different things after from just discussing one question. So I can tell you this with confidence that you can entirely put that faith in BTR, but just make sure that you have covered everything which BTR has to offer. Just don't pick out things from BTR and then go with that mindset that now that I've covered everything. Ma'am, it's not everything. You have to complete BTR to the entirety. Second, how to improve your GTs from 135. See, I feel that 135 is relatively a good score. I don't feel it's a bad score specifically for INICT. I will tell you, I had a number of corrects were 145 when I got a rank of 109. So this is how INICT tests you. It is relatively on the very tough side. 145 corrections correct is nothing if you consider NEET. But if it is a difficult exam, then a 135 to 40 is actually a decent score only. How to jump beyond that is one. Definitely just make sure that you segregate your mistakes. Try to figure out where you're faltering. Maybe it is a silly mistake. Try to split it into three: silly mistakes, new topics, and recall error, right? So split into three and very selectively put these areas. Okay, this was something I was faltering, this, and I will specifically focus on that. If silly mistakes is an issue, then time you are not putting in that time, you're not sitting for 3 to 4 hours ka slot in one stretch, right? You have to train your mind into sitting for that many hours, only then it will not be distracted in the exam hall, right?
Okay. Okay. Yeah. And like, is there any difference in INICET May versus November? The pattern, the weightage is, as you said, it's more or less everything is the same. But is there any difference in pattern because you aced November, so like you know it better? Like,
Okay. Yeah. So one reason is that people do perform better in November is because the number of participants are less. There is one batch which is totally not even eligible, right? There are less number
okay,
of participants in November, but around, I think, 10 to 15K is the difference. One is that, and secondly, you know, I don't feel the type of questions are different. Seats, the number of participants are different. In May, what happens is that there is a fresh batch, that is sitting for the exam hall, and fresh batch is obviously more. I feel that they are fresh. They have a better mindset. I feel that is why the ranks drop in May and ICT. There is no other factor. The exam is almost at that same par only, same level only.
okay, okay. Thanks. Okay, okay. Got you.
Yeah, and
There's one,
Dr.
there's
Sapna
one,
Thakur.
yeah, yeah, there's one more question from Sakshita. Sakshita, meaning of SWT.
Yeah.
And
SWT is short for subject wise test. You can find it on any platform. You go to that QBank, whatever question modules, there will be a column separately for subject wise test. These are 50 questions and they have a specific timer as well. You will also get a rank. There will be extensive GT review after that. Sorry, the SWT review after that as well. There will be pearls attached to it. So, this is a better guide of where you are for that particular subject, all India level where you stand, right? So I feel you should give these subject wise tests once you are done with the entire preparation of that particular subject. Take it as a test and prepare for it.
and there's one that your MCQ source for the exam and for final year subjects clinical questions to be particular medicine. Like which one is your MCQ source?
Okay, my MCQ source was basically Marrow only. Uh, I don't want to, promote any platform, but because I have done that only, and for MCQs, and many people have done that, it is a reliable source. I would say there are not. I have never found any error. Firstly, any error. Secondly, the interface is really good. You will find it very easy to just surf through these questions, just go to another topic. You will also find pearls attached to it, flow charts, tables. So I feel Marrow is something that you can definitely look forward to.
Sapna, yes, please, you're saying something?
Yes, ma'am. Thank you so much. Anisha, ma'am, I would like to ask you that did you use BTR?
Yeah. I was a big BTR subscriber.
Okay, but ma'am, if I ask my personal question, I have not done BTR completely. So, for with respect to INICT November, what all are the subtopics or the sub compartments which I should definitely go through for my INICT from BTR? I have not done BTR completely.
Okay, so I feel that there is a thing of compiled modules in BTR. There are certain, ma'am has put out these specific modules for infections, cancers, cross-sectional anatomy, and histopathology. There are these compiled modules which ma'am had recorded very long ago. There are while I was preparing in 2023 and 2024. You can do those. This will definitely fetch you that extra edge, because what happens is while you're preparing through the rapid revision, you miss out on certain these niche things. Ma'am has covered it in the compiled modules, but ma'am has recently just, created these modules Robin special, Guyton special. I don't feel that that is something that you need to do, because it's, it's a little bit extra, I would say. So just make sure that you go through the compiled modules which ma'am had recorded very, very long ago. These are 5, 6 videos of histopath class, cancer class, graph class, cancer I've done, and what
Maybe
else? Cross
formulas,
sectional
formulas,
anatomy class.
formulas.
Formulas, yeah, formulas and instruments as well. Instruments, so you definitely would do otherwise
Okay,
also.
okay.
One that. Secondly, I feel BTR END is something which will definitely help you, right? Because what happens is that these ENDs are basic questions only, but whenever ma'am usually solves these questions as in a form of video only. So you attend the review, the review of BTR END, and you will feel that ma'am explains these questions, and ma'am discusses 2, 3 other topics also. She also explains you on how to go about that particular question. So BTR END is something which will definitely help you in case you need to be clearing your basics, your how to approach a particular question. So END is something that you can do.
Yes, ma'am. Thank you. Ma'am, one more question that mega BTR madam always takes before exam. Since I was not a BTR subscriber or a thorough follower of BTR, is it very important to attend those, because you might have done that in the last week? I think ma'am takes mega BTR revisions, or it's something like that. For she had taken it for NEET PG, and she always takes it for INI also. So is it advisable that being a non BTR subscriber, we should go for it? That mega revision or
Uh,
something like that. She takes
yeah,
it for
I
all the
get your
19
point.
subjects in somewhere 3 days, 3 or 4 days. In the last 10 days,
Hmm.
which schedule you have given us, is it advisable to go through that?
Okay. So see, what ma'am does in those mega need BTR is she actually just picks out these, whatever I told you, that volatile topics and the most important topics for all the 19 subjects from her own BTR only, right? And she picks
Okay.
these out and maybe adds 1, 2 extra things for these particular topics, and that is it. So I feel if you're somebody who's already not done BTR, then it will be too much for you. Secondly, it will be
Hmm.
overwhelming for you. You will feel that there are things which I've just left, but that is not the case. Now what people are doing wrong is that they are going into this FOMO of not going through BTR. That is not the case. I know so many people who have never done BTR and have aced the exam, right? So you don't need to do that BTR and mega need BTR if you've not done BTR per se.
Okay, ma'am. Thank you so much, ma'am, for clearing all my doubts and questions. Thank you.
Mhm. Yeah, my pleasure. If we take BTR ENDs religiously, the latest 2 series we can ignore. Yeah, definitely. See, I will tell you one thing. Trust one source. You can trust 2 sources. That is totally fine if you feel that you can actually club them, but it should not be so much on your plate that you are overwhelmed, you are perplexed on what to do in the last 10 days. There should be content which you trust. Firstly, you should trust ki, okay, I have put my trust into this, I will just do that. And secondly, it actually does suffice. um, I myself have followed just BTR and marrow RR for certain things, and plus solved a lot of questions. Because you have to also accept the fact that no matter how much you try, there will be things which will be left out. So you just make your best shot, take your best shot by doing things which are actually important also and volatile also. There will be things which you might have not even revised in those 3 months, but they will come to you naturally if you've done it any time, even long ago. They will come to you. Your aim at this point of time is that you cover the volatile and the important things. Anything that you do should have these 2 factors, that it is volatile and it is super super important. Other things will definitely come to you, right? And secondly, trust one thing, it will cover 90% of these things, which exam in from which the exam will come. If you trust dams, that will also cover 90% of the things. There, the overlap of 10% is different. There will be things which dams will not cover, there will be things which marrow will not cover, but these are not important. What is important and volatile will be covered anyway. So you follow one thing and you just leave out of that FOMO, right? Try marrow RR of Ophthal BTR2 for Ophthal, it's really great. Yeah, you can do for ophthalmology for anyone, I would say. You can do RR also, you can do BTR also, just do one. You don't need to club those. It is 99.8%, I would say, with that confidence, similar only. So just do one, right? And yeah, I think that is it.
There is one question that which subject or topic will you recommend to watch for the main videos, from the main videos for INICT?
Pharmacology, the only subject that I have done from main videos. Pharmacology is something that will not naturally come to you. It's a fact-based subject. You have to go through extensive theory. Only then you will be able to solve the questions. Plus, INICT loves giving you very difficult questions from pharma. If there are, I don't mean to scare you, but if there are 15 questions that are going to be coming in the next INICT, there will be around 10 questions which will be tough. Which will be tough. So I would say focus on pharma as much as you can. Do GRG search pharma as much as you can. Theory will definitely help you. You can skip doing RRs, even RRs for the 5 minor subjects of final year. You can just do BTR for that. Save that time and utilize in doing pharmacology, because questions will not naturally come to you. And do PYQs, but you don't need to do new extra questions for pharma, because theory and questions are same only. This is a fact based subject. It will not there will be not different, there will not be any different questions. This will just be directly out of theory. So just solve theory, just read theory as much as you can for pharmacology.
Okay, if there's no any other question, we'll end it up. Anyone, any
Yeah.
questions? No, no, I think we are good to go now. How are you doing, Anisha? At beginning, I forgot even to ask how everything's going at your end.
Everything is going great, ma'am. I've completed 8 months of my residency, and it actually feels nice to be here. And now I'm really happy that most of the people have already. I was really excited that after NEET PG people will be relaxed, because I could relate to that. Last year I was so relaxed after my NEET PG. I could not care less about INICT, but I can see the people's dedication, that they're still here even after 10 days post NEET PG, and trying to learn on how to approach INICT. This is a very good approach. I wished I could have given INICT last year also, but I did not have the courage. If you can find that courage, if you can actually make that effort, it will definitely help you guys. And I feel after 10-15 days maximum, NEET PG result will be out. So good luck, guys. I'm like really looking forward for my juniors to come.
Right. I'm really looking forward to have a lot of stories to share.
Yeah, a lot of stories, definitely.
Definitely a lot of
Somebody
us.
has raised their hand. Yeah.
Yes, Asakshita.
Good evening, ma'am.
Hi,
Ma'am,
good evening.
actually, I had doubt regarding medicine that I'm confused. Like, should I, because medicine, I don't know, I somehow mess up, or my confidence gets a bit lower whenever the question comes in exam. Maybe it gets correct later on, but this happens with me with medicine only particularly. I've done medicine mean marrow notes during my final year and give them a reading during NEET. So, and done BTR also for that. Now for MCQs particularly, I'm not sure like what to do. Like for those certain topics which I always mess up with, should I just do their Q banks, or should I purchase any MCQ book for medicine and like go through whole medicine like question wise through that? So I'm confused for that.
Okay. See, Sakshi, what you can do is, if you already know what your shortcoming is in these medical medicine questions, you've segregated these topics, then you can solve the dedicated Q bank for these questions. I remember ECG was a difficult spot for me, so I solved so many ECG questions that by the end of it, I had mastered ECG. So whatever you feel is daunting for you right now, solve as many questions as you can. You don't need to buy another platform or books. No, just go to if you have Marrow or Cerebellum, whatever you have, just go to that specific module of these topics which haunt you, right? And solve many questions, as many questions as you can for that particular topic, and that's it, right? That is it. That will build the confidence.
Okay, thank you so much, ma'am.
Yeah, sure.
Thank you, Anisha, for this, and all the best to everyone. Start studying, and if you have any problem, we will again connect for the session. But for now, we'll end this up. I think you all have got the enough information to start your prep. So thank you. Thank you, Anisha. We'll close this up now.
Okay, thank you, ma'am.
Bye. Good
Bye-bye.
night.
Good luck, guys. Good night.